Hi there, Tim Nichols back, and I've deviated from the usual format of just the single talking head. I brought on a guest. This is Tony Cochran, CPA, business consultant, and a dear friend with, we go back many, many years, but Tony has more experience in optometry business management than any optometrist I know, number one. But he has a kind of a unique perspective. Explain that, Tony.
Unique perspective on optometry?
Well, how you came to be such a
okay.
guru of optometric management.
That's probably a long story, but the Cliff Notes version of how I got started. I graduated with three gentlemen that eventually became optometrists, and then went to college with a fourth optometrist. And so all of those went through the School of Optometry together, and immediately when they came out of the School of Optometry, I inherited four brand new practices and had to learn optometry, baptism by fire.
Yeah.
And through that core that I started with back in the early 1980s, that grew because in those days, unlike today, we didn't have corporate optometry. And so almost every optometrist that graduated from the School of Optometry was headed into private practice somewhere. Either they were buying a practice, they were going into a practice that eventually they would inherit, or they were starting their own practice. And so practice management of optometry became something that I really need to learn, master, so that I can do a better job of helping my optometric clients.
Now these clients, and like myself, have kind of stumbled and bumbled our way through the first number of years of our practice, and some of them never quit stumbling and bumbling. So what are the mistakes that you see? What are let's say, the four most common mistakes that you see optometrists make in their practice?
Well, not in any particular order, but just what comes off the top of my head is, number one, they have a tendency not to ask for help. They just graduated from the School of Optometry. Prior to that, they fought their way through 4 years of undergraduate school, and so they're very smart people by nature. You don't get into the School of Optometry without being smart, and you're not a successful candidate coming out of the School of Optometry if you're not really smart. So these are really smart people, but they have a tendency not to ask for help. They feel like, I should have all the answers by now. I need to know how to do all of this, including running a business and how to work with and communicate with bankers and and all those other parties out there, whether it be supply vendors. I should know how to do all those things, and so they don't ask for help, and that as a result causes a lot of pain and agony that they don't necessarily have to go through, because they just simply don't ask for help. Probably that leads me into the second thing, that is they have a tendency to want to do everything themselves because they probably have school debt. Now they're dealing with the debt associated with buying a practice probably in this day and time. So they have all this debt out there that they're carrying, and they have this burden. So to save money, they're trying to do everything. Instead, what they should be doing is delegating those things that aren't highly productive in terms of the level of production a doctor can create. So they do everything. But overall, the overarching thing is they really don't have a plan for success. They don't have a plan for how they're going to grow the practice. They don't have a plan for equipment replacement and the timing of that. In other worlds, we talk about capital budgets, so they don't really have a budget, for, what I'm going to buy, when I'm going to buy it. Is it a standard care issue? Is it I can make more money if I have a particular piece of equipment in my office, that I can get reimbursed, for those services? You don't have a plan. And then probably fourth, segueing off of that, is they really don't have a system and a process, for doing anything. They just, whether it be how we greet patients as they come in the door, how we answer the telephone, to the process moving through the office, to the process of how I train a new employee, the process of how we handle a patient in the optometric dispensary. You know, we don't have processes that we are documenting so that every time we have turnover, and we all do, then we're having to go teach and spend a lot of time with an employee, or conversely, we spend no time with that new employee, so they're doing something in their job in a way that we really don't want them doing it, but we have no clue they're doing it, you know, that way until a patient complains or we lose a patient, you know, and somewhere down the way we discover that, you know, we didn't really teach them to do the job. So I think that would be it. Probably if I reordered those, it would be, let's have a plan, let's develop some systems, let's ask for help. You can get help to do both those two things, and don't do everything yourself.
Okay, great advice. All right, thanks, Tony. In a second part to this interview, we're going to talk about the things that optometrists need to be doing. So tune in to part 2.